I want to thank everybody for joining us today. We'll get started now. I'm Tom Ketchkamethy, Executive Director of the American Academy of Political and Social Science. Today's panel on the impact of COVID-19 on inequality in the United States is a collaboration of our Academy, the Brookings Institution, and the Social Policy Institute at Washington University, St. Louis. Our colleagues at WashU, Michael Grinstein-Weiss and Eddie Lawler, along with Carol Graham at the Brookings Institution, are the special editors of a volume of our journal, The Annals of the American Academy, that was published earlier this year and titled The COVID-19 Shock to Our Deep Inequalities, How to Mitigate the Impact. So our idea for this virtual session is to bring some of those findings and ideas that we explored in that volume to a broader audience, but not at all limiting the conversation to the contents of our research alone. So today we have three terrific expert voices from that volume of research who will talk through some of what we know about the disparate impact of COVID-19. Carol Graham is a senior research fellow at Brookings and director of the Global Economy and Development program there. She's also a professor at the University of Maryland and a senior scientist at the Gallup organization. As I mentioned, she's one of the co-editors of our special issue, and in it, she co-authored a fascinating piece about the ways in which the detrimental effects of COVID-19 have been entwined with deaths of despair in the United States. Bradley Hardy is an associate professor at the McCourt School of Public Policy at Georgetown University, a non-resident senior fellow in economic studies at Brookings, and a research fellow with the Institute for Economic Equity at the Federal Reserve Bank in St. Louis. He co-authored a piece in our volume titled Crashing Without a Parachute, Racial and Educational Disparities in Unemployment During COVID-19. And Shannon Monnet, who is the Lerner Chair for Public Health Promotion and Director of the Lerner Center at Syracuse University. She's also a professor of sociology and co-director of the Policy, Place, and Population Health Lab at Syracuse. Her contribution to our volume was titled Rural-Urban Variation in COVID-19, Experiences and Impacts Among U.S. Working Age Adults. We're also very lucky to have Oren Cass join our panel. Oren is the executive director of American Compass, which is dedicated to the importance of family, community, and industry to the nation's liberty and prosperity. Previously, Oren was a senior fellow at the Manhattan Institute and a domestic policy advisor for Mitt Romney's presidential campaign. And it's hard to imagine a better moderator for today's session than the one we landed. Zeke Emanuel is an oncologist by training and now the Vice Provost for Global Initiatives and co-director of Health Transformation of the Health Transformation Institute at the University of Pennsylvania. Formerly, he was a special advisor for health policy in the White House's Office of Management and Budget and a chair of the Department of Bioethics at the National Institutes of Health. This session is being recorded, and we'll send a link to the recording to everyone who registered for the event soon after we're done. Also, social media, we're live tweeting using the hashtag #AcademyMeets. Feel free to join us using that hashtag. We are going to be reserving a little bit of time at the end of the discussion for Q&A. So if you have questions for the panel, please put them in the Q&A function box at the bottom. You'll see at the bottom of your Zoom screen. And now it's my pleasure to give you to Michael Grinstein-Weiss for just a couple of minutes. Michael is a distinguished professor at the Brown School at Washington University in St. Louis and director of the university-wide Social Policy Institute there. To say that she is a tireless force of nature in terms of the energy that she brings to work like this is an understatement. She's going to give us just a little bit of an overview about the issues that we deal with in our volume before the panel gets started with Zeke. So Michael, please go ahead.
Thank you so much, Tom, for this kind introduction and generosity. As Tom said, I had the privilege of serving as the co-editor of the annual special issue, alongside with my esteemed colleagues, Dr. Eddie Lawler, Dean Emeritus of the Brown School at Washington University, and Dr. Carol Graham, who we'll hear from today. And we are so thankful for Tom and the team for trusting us with this important issue. This special issue brought together more than 20 authors across diverse disciplines and sectors who are committed to using empirical research to build a more equitable future. In 2020, when the pandemic was still very new, we felt strongly that we needed to write this special issue. We knew early on that the pandemic would not only spotlight the desperate outcomes of inequality in our system, but these inequities would also have significant long-term consequences for underserved, vulnerable populations. Our special issue is unique because the manuscripts were written in real time while the world was deep in crisis, facing unprecedented challenges. We wanted to learn from this moment and understand what was happening. More importantly, we wanted to learn and identify strategies that support an equitable and inclusive recovery and future for our society. Today, you will hear from several of our authors, as well as other experts, as Tom just alluded, about evidence-based continue to recover and rebuild. One thing is clear, we can't go back to how things were before. How can we change policies to improve life for vulnerable population? We need discussions like this one today, where we acknowledge where we fell short and identified solution to going forward. On behalf of my co-editors, we hope you listen carefully to the conversation today and identify a few key themes to incorporate and work. Now I'm delighted to pass the conversation to Dr. Zeke Emanuel. As Tom said, I'm so honored that Dr. Emanuel is here today to agree to moderate this panel. I can't think of a better person, qualified background and expertise to navigate this important conversation. Dr. Emanuel, the floor is yours.
Thank you, Michael, for those kind words. I only wish my mom had logged in. So it is a great honor, actually, to participate here and to moderate this panel, in part because I think inequities are a major issue. We knew that they existed before COVID. COVID has both exacerbated them and brought them to light so that we cannot hide from them. And hopefully we will be able to thoughtfully address them and mitigate them, if not eliminate them. I'd like to begin the discussion with you, Shannon, because I found your paper very interesting. There's a lot of thinking about the rural-urban divide. I think if you tap an educated person on the street, they would say, oh yeah, that's the Trump Democrat divide. It's the red-blue divide. Those red people, they don't want vaccines. They don't wear masks. The blue people, they want vaccines, they wear masks, and that explains it. Is that true, or is that a sort of false narrative bred by certain graphs that appear in the popular press but don't reflect reality?
Great questions. Partly true, partly not true. It sort of depends on the type of rural place that we're talking about. Just talking generally, I mean, in the early months of COVID-19, I think a lot of people thought that rural areas would be less affected because they have lower population density and that would protect them against spread. And that was true, but it was true for only a short period. So COVID-19 infection and mortality rates started out higher in urban areas, but by late 2020, they were higher in rural areas, and they've remained so ever since. And there are a lot of explanations for that have been related both to the characteristics of the types of people who live in rural areas, but also structural factors that have to do with institutions and policies. So in terms of, the types of people who live in rural areas, rural populations are more socioeconomically vulnerable. They're older, chronic diseases are more prevalent, so that places people at greater risk of death should they become infected. It is true that across many parts of the rural US, residents were more resistant to engaging in certain types of preventive behaviors, such as mask wearing, avoiding gathering. Vaccination rates were lower in many rural areas. In another paper that I published with a colleague of mine, we show that lower educational attainment and greater Trump support in rural areas were the main explanations for lower rural vaccination rates. So there's no question that politics have played a role, but there are also structural reasons for higher infection and mortality rates in certain rural places that move us beyond individual behaviors. So for example, government deemed essential industries like meatpacking and agriculture and prisons are disproportionately located in rural areas. And that places workers in those types of rural places at increased risk of infection. Certainly healthcare resources are more limited in rural areas, so it makes it more difficult to treat people who became infected. And governors in rural states were slower to enact stay-at-home orders, and they were less likely to enact physical distancing mandates than governors in more urban states. So all of those factors played a role in higher infection and mortality rates in rural areas.
But Shannon, one of the interesting findings you have is that what you call rural adjacent, those rural areas which are nearer big cities than the far off middle of Wyoming, those places actually did the worst. Why do you think that is? It's perplexed me, and I have to say, confused me.
Yeah, so the paper that I published for this volume was on the impacts of COVID beyond the physical infection and mortality impacts. So what I found in this particular paper is that residents of rural counties who were adjacent to metro areas had more adverse economic impacts. They were more likely to report being late paying their rent and mortgage, not being able to afford groceries and other bills, needing to get a loan from friends or family. And this may be because residents of those counties that are adjacent to metro areas are reliant on those economies for jobs. So we know that in the sort of early months of the pandemic, a lot of bars and restaurants and other non-essential businesses had to close down. And so some of the residents of the rural areas who were commuting to these places may have had adverse employment and economic impacts. They also might have not been able to, do the shopping that they're used to doing or get the other types of supplies that they're used to getting. So I think all of those factors may have played a role to make these areas sort of more vulnerable to the negative economic impacts than, say, the remote rural areas that may not have had as much, there weren't as many business closures in those remote rural areas, partly because the politicians in those states were sort of less likely to enact those sorts of mandates. And even when the mandates were in effect, they weren't always enforced.
Interesting. Carol, I want to ask you, I'm an oncologist, dealt with many, many terminally ill patients. And one of the things we do know is that, to some extent, denial and hope, even when that it's not borne out by the empirical data, can be important defense mechanisms and important in making good of a bad situation. This is something you investigated in light of COVID and found that hope was more prevalent among Blacks. How do we make sense of that? And did that help in a bad situation? And could it be counterproductive by not trying to actually solve the problem, but sort of acquiesce in accepting the bad situation?
Anyway, I said, thanks, Zeke, for another good question. Before trying to answer you to the extent I can, and I do have some answers, I just wanted to follow up on two things that Shannon mentioned, because that showed up in our paper as well. So in addition to the findings on well-being and ill-being and optimism and hope, which I'll speak to in a second, one of the things we were trying to understand going into our paper, which was on when twin public health crises get intertwined, was whether the same places that have high levels of deaths of despair, which are much more likely to be rural, would also have higher COVID deaths. And you just see the time trend changing our findings. In fact, we found much more since then, since we published. And as Shannon mentioned, rural areas were protected at first, and then over time, I think all of their other characteristics like less access to hospitals, less access to healthcare, and higher levels of Trump voting, which seemed to signify also less protective behavior, mask wearing, whatever, ended up meaning that the same places with high levels of deaths of despair, which were rural, ended up with higher incidence of COVID deaths. So I can speak more to that later. But now to your question, this finding on hope and resilience among African Americans, particularly low-income African Americans, far predates COVID. In fact, it's a historical finding. When I first got it, which was in 2015, before the deaths of despair data was out, it was during the St. Louis and Baltimore riots, a time that there was high levels of violence against the African American community, another George Floyd sort of era. And I found this finding that low-income African Americans were 3 times more likely to be optimistic about the future than low-income whites, and Hispanics were in the middle. And I thought I had a coding error. It just didn't seem to make sense, right? How could this be? And I looked into it many, many different ways, including historically, as I mentioned. But one of the things that I was worried about and tested for very early on was whether it was a sort of a potential negative thing, a Pollyanna thing, a denial. The only way you survive in situations that are that bad is to be optimistic, kind of the tragic optimist. But I've found the difference between hope and raw optimism to be that hope actually means that you believe and will try to make things better. And I think that more characterizes this trait. It lasted through Trump's election. It lasted through the George Floyd era. I mean, it doesn't mean that these high levels of hope don't coexist with higher levels of anxiety. They can coexist among the same people. And we do see anxiety rising among all groups, but certainly African Americans and low-income African Americans at the same time. But what we find when we ask other questions, like how's your financial situation, or how's satisfaction with the place you live, that these same low-income hopeful respondents are much more realistic about their situation and the structural problems they have to face. Now, I have to say, I even was quite surprised that the high levels of optimism lasted throughout we did a survey with colleagues at WashU running through 2021. So really the main run of the pandemic, we obviously still have it, and found that these high levels of optimism continued. So do I think it's ever negative? I'm sure there are some cases where, hopes aren't met and there's disappointment and anger. Did people fare better because of it? That's really hard to test. I mean, I don't think we have a way to do that. What I do think and find is that over any number of crises, and including the deaths of despair crisis, it is the community that it's not just an individual trait, it's a community shared trait that's supported. And African Americans and Hispanics have just stronger informal communities that are really helpful in coping with crises. So I think there had to be some positive effect there, even though we can't really measure it. We used to gauge it in some ways by the fact that Hispanics and Blacks have much lower levels of deaths of despair than whites and much stronger communities. Unfortunately, in 2020, African Americans entered the rates of deaths of despair at one in which they have not before. But I think that was as much due to fentanyl, the availability of fentanyl, as it was to COVID. So again, a very complex story that we can't disentangle. But I would say, on balance, hope is a really good thing. In fact, an essential thing. And we also find in other work that it's linked to higher levels of longevity and other things. Now, it won't cure cancer, but it certainly is helpful with diseases that you have to just, persist to overcome.
Well, Carol, maybe I can push back a little bit on that, or offer a different kind of lens. As you were talking, one of the things that occurred to me is certainly when I was growing up, people used to say, they commit suicide in Sweden, but they don't commit suicide in sub-Saharan Africa. Sweden, they're much better off than they are in sub-Saharan Africa. Is it part of the situation, whether you're looking up or you're looking down, and maybe among low-income whites, their situation is declining, and therefore they're less hopeful, whereas the situation for lower-income Blacks, they are maybe they're looking up, and so the expectation is that things will improve as they have improved, although not dramatically?
it's a realistic, it's absolutely realistic interpretation, because the trends show that the gaps in longevity, in education and marriage rates between low-income whites and low-income blacks have narrowed significantly. And indeed, low-income whites are going down, and low-income blacks are gradually, against all odds, making progress in a good way. Again, fentanyl's become a game changer that we don't really know how to deal with. But that aside, I think your interpretation is right, that there's, if you're looking forward and you have a sense of the future, it's much better than if you're going down. But I would say two other things, and I think they're intertwined explanations. The role of community is very underestimated. And I think it is those communities that help people look up when things are hard, and they also hold people together or a bit when they're faced with despair and bad challenges. And low-income whites are notoriously, very isolated, very, they pride themselves in not wanting government aid, not wanting, it's sort of it used to be the Ozzie and Harriet family, that was it. And now that's gone too. So it's a very lonely existence. And secondly, another explanation is that suicide is in a way a stigma in both Hispanic and Black communities. It occurs much less often. I don't know if that's a good or bad thing, except you have less suicides, which is a good thing. Or maybe it is the fact that there's sort of community, some sort of sense that you reach out to people before you commit suicide that helps. But so anyway, again, a complex story, but I would say on average, I still think it's a good thing.
We're going to come back to the question of community and burnout among professional classes, because I think one of the interesting things is you might not get suicide in professionals, but you get a lot of burnout. And I wonder if those are similar responses just because of different socioeconomic circumstances, a little different. Bradley, I wanted to ask you, you've written very provocatively about the joblessness, unemployment, inequities, but also the fact that low-income people had to work this whole time and were not, they were not spared. They could not work from home remotely. Is this inequity here? And how did the government's public policy to step in and financially support people affect that inequity?
Sure. No, well, I appreciate the question. We were certainly in our work kind of documenting these pretty stark joblessness gaps throughout 2020 and 2021. In other work, and including work that I've tried to survey and sort of synthesize, the broad kind of panoply of U.S. governmental assistance, economic assistance, pandemic UI, so on and so forth. That absolutely provided an important buffer for low and moderate income families disproportionately impacted by the pandemic. I think it's been discussed pretty widely now that folks who we coded in our own work as kind of quote unquote frontline industries were more affected by job loss than sort of more white collar workers who could make that transition into, say, a virtual environment, virtual computing environment, things like that. So those front-facing workers were impacted adversely. But the economic assistance was helpful. Two things can be true at the same time. There were certainly lags and gaps in the provision of assistance. And so you saw this sort of ebb and flow where if you were to look at the census data on this, the pulse, that families had reduced economic hardship, reduced food hardship associated with the delivery of these benefits. Certainly the expanded 2021 child tax credit was hugely beneficial, frankly, across race and ethnicity. So, I think that these families were greatly helped by the sorts of tools we deployed. Much like the medicines in your field, I don't think you can implement a policy without some cost. And so, I don't think the policy was delivered perfectly, but I think that when you consider the counterfactual, there was a lot of good associated with this. I would just say very briefly, we kind of indirectly tested some of the work that Carol was into, and we did find this interesting puzzle as it is. where Black respondents reported more economic hardship, less in the way of a mental health response, and sort of more likelihood in using alternative financial instruments, selling plasma, payday lending, overdrafting their checking account, things like that. So I'll stop there.
Well, you can't stop there. Does that suggest that the hope may be artificial, or does that suggest they're better at coping with these circumstances? I often, from my own research, especially internationally, I often say, people are poor. That doesn't make them stupid. It makes them much better at figuring out how to survive and figuring out how to cobble things together. And they're not sort of woe is me with their hand at their head, but they're figuring out how to do it.
It's interesting. I mean, so my research on a good day is sort of on the labor market, income volatility, social safety net. What I would offer up are some reactions and, future questions. Now, Carol's kind of resident expert on this topic. A couple things though. I do think that if you consider the US context and sort of intergroup dynamics, certainly the kind of the social, economic, and political history of the US is that Black Americans have been considered to be sort of the lowest group on sort of a totem pole. And so I do think that to the degree that groups perceive themselves to be converging sort of qualitatively downward, that can be viewed differently than a group that's sort of historically always been at the bottom, that may maintain their position at the bottom, where some group members may move up. Now, again, that's a hunch on my part, just thinking about how those relationships play out. I certainly know that there's more public health efforts to help Black Americans build comfort level with acknowledging mental hygiene, right? Nonetheless, though, I do believe the result. And for years, I've been paying attention to this with Carol, and I want to learn more because I think it's an important result. But with that said, I also think that we know that economic resources, income transfers, they actually do help improve socioeconomic outcomes. Reduced income volatility is associated with improved mental health outcomes. So the safety net has a role to play here as well.
So let me ask you just one additional question here before.
Sure.
And that's on the child tax credit. I think it's safe to say, maybe it's not an ideal program, but it is it's a reasonably well-designed program in that people get it monthly. It goes to children, it goes to families. We know that they use it mostly for children. We know that it reduced child poverty, I think 40% or something during the pandemic. Super home run. Now, frequently in this country, we hear politicians and everyone else say, our most valuable resources are children. You would think that making this permanent, the CTC child tax permanent, would be like a no-brainer. It would finally put us on parallel with places like France and Germany and other countries. And yet the political will doesn't seem to be there. Is there a reason for that? I mean, I have to say I'm totally perplexed. I would have thought that it's the single best social governmental expenditure of resources we could do.
Right. It's interesting. I mean, look, so by way of background, super briefly, the US is modeling off of a program in Great Britain that really lowered child poverty dramatically. And so, you had poverty scholars for years working on this through the National Academies of Sciences. And so this was kind of the result of a lot of momentum to try this out. And I think that on the margin of poverty reduction, it appears to have been quite successful. Now, ultimately, I think that there are discussions around the degree and extent to which pumping that kind of cash, we're talking about $3,600 per very young child, $3,000 per child between 6 and 18. Look, divided up kind of on a monthly basis, does that disincentivize work? And so, I think the reality of the matter is that you had mixed evidence on that. I think for me, it seems like the benefits outweigh any potential costs associated with the work disincentive. I can't sit here and say that there's not people who pull back on some work activity. On the other hand, I know many families might laugh in my face if I were to tell them that, $3,000 to $5,000, $6,000 is going to keep them out of work altogether. On the other hand, I think there's a lot of folks who would make the argument that there's a lot of productive activity associated outside of the labor market, right? Childcare, time with kids, things like this. So, my view is that there is a concern in the country around social safety net programs disincentivizing work. I think some of that conversation is racialized, not all of it. I think that we have to pay attention to the evidence. Right now, the evidence is certainly not clear cut that there's a big work disincentive from this. I do think that this is the sort of program that could yield pretty good long-term outcome benefits for society, kind of on a cost benefit basis. And that's where the new public finance has been going, looking at kind of these long-term societal benefits. So you might think it's a morally good idea, but I think it's also kind of on an accounting basis. These sorts of investments, they could pay for themselves.
Can I just throw something out there, Zeke and
Absolutely,
Bradley,
Carol, please.
into your discussion? One, having started my career looking at the coping strategies of the poor in very poor countries, including Peru, where I'm from, they're incredibly sophisticated. I did it, and I think, Zeke, you're spot on there. But secondly, and this goes to Bradley's last point, economists have screwed up royally, assuming that the opportunity costs of the poor are low. They're people, they have kids to take care of, and they work many longer hours than rich people do. And that, so maybe there's some work disincentive that, as Bradley says, but it might be exchanging for time with kids, and things that are productive and really socially important. So that's just throwing it out there.
Yeah, but I think that's a very good point. And Oren, I would like to put it to you. I don't want to pick on you in this, but it does seem to me that there's a sort of confusing, perplexing position, especially on the right, where we say, let's build up families, let's, get people or mothers to stay at home. And I think it mostly is the rhetoric around mothers staying at home, raising their children. And yet when we have a program that seems to, maybe it's neutral, maybe it's having some of people who are marginally working staying at home, it's like, we're not going to pay for it. And that seems a confusing thing. And so that leads to a more general question to you about, what of the great transformations that we've experienced because of COVID, which ones are good? And then which ones do you think are going to stick?
Well, I think, on the child tax credit point, and this is certainly one of the sort of broader transformations and debates we're having, is really the question of the role of government policy and fiscal support. And I think something that was really interesting that we saw at the outset was really a quite enthusiastic bipartisan embrace of really aggressive fiscal support. I think most analyses have found that the U.S., regardless of what you think of the public health response, in fiscal terms, was really, right at the top of the list in supporting households and delivering good outcomes. And there wasn't a lot of fight about that. In fact, if you go back to sort of the check the tape, it was Republicans like Mitt Romney and Josh Hawley and Tom Cotton who really led well, let's just send everybody a check concept. Of course, it was Senator Rubio who led the Paycheck Protection Program to just get the money to folks to try to keep them connected to work. And so in that respect, I think it was really encouraging to, in a sense, in the moment of crisis, see some real consensus and commitment to that approach. I think what you see in contrast is a view that should by no means be business as usual.
Although correct me if I'm wrong, Mitt Romney did propose a child tax credit, which was, at least by some analyses, better than the Democrats' child tax credit, and that was a permanent proposal. I mean, it was a proposal to make it permanent.
Yes, Senator Romney did, and got essentially no support from the right of center for it. And last week, he therefore came back with a revised proposal based on a lot of work that we've done at American Compass to say, how can you get a very generous benefit to families that is still connected to work? And that's something that now has Republican co-sponsors, that's gotten a lot of support everywhere from pro-life movement to American Enterprise Institute, sort of more on the pro-business side. And so that, I think, is exactly the distinction that I think even on the right of center, you see a lot of enthusiasm for policy that's going to more aggressively support families, but you still see that idea that it should be connected to work, and meaning that a household that truly has no one working, is earning no income of its own, should not be participating in these kinds of programs that actually just get regular cash payments. We of course have a broader safety net, especially for families with kids in any circumstances. But I think what you saw politically is that a lot of Democrats looked at what happened in the emergency COVID relief and said, well, let's just make that permanent. And not only did Republicans not agree with that, Americans didn't. One of the most fascinating survey results I saw back when the debate about making the CTC permanent started was you had Americans simultaneously saying they supported the one-year CTC and opposed the permanent CTC. Significant pluralities, The Economist, Morning Consult, and then our work as well found significant pluralities opposed making this unconditional child benefit permanent, even as they supported it in the 1 year. And so that's, first of all, that's a remarkably sophisticated
response
thought process, I would say, for your typical poll respondent. But I think it gets to something deep and important, which is that, you know, if you think about where we have really effective social insurance programs, things like Social Security, we do connect them to work. And we do say we want to support everyone, we want to have a safety net for everyone. But we also recognize that working matters. And if you look at what we've proposed and now what's in the Senator Romney proposal, the threshold is very low. So essentially, someone working part-time at a minimum wage job is going to qualify for the full benefit. And that's why I would say there isn't really a trade-off between, you know, wanting to make sure parents can spend time at home with their kids and also making sure that a household has a connection to work. You actually can pursue a policy that does both.
So let me push you. We've all seen and we've all experienced the dramatic transformations in work culture. Here I am broadcasting from my spare bedroom, you know, and doing my teaching in many different ways as a consequence of this. But I'm privileged, right? I have a job where that can happen. A lot of Americans don't. Is the new work situation, which is still evolving, going to reinforce inequities between those who can do remote work and get that extra, call it hour and a half a day that they're not commuting, spend it on themselves, their family, whatever, and those people who have to be present because they're in a service line and therefore don't get that benefit? Is that just going to reinforce inequities, both economic and racial, in our economy? How do you see that, Oren?
I guess I see the shift, generally speaking, being a positive thing. If we think about what COVID has done to the labor market, and what remote work means for it. And probably the most important reason for that is that it just makes geography less important overall. And this goes back to something that Shannon was talking about at the outset. But obviously, you know, economic development in America over the past few decades has been highly unequal and geographically concentrated in ever narrower urban, mostly coastal slivers. And that's a reversal. Historically, we had what we called convergence, poorer states, poorer regions catching up. That flipped around 1980. And I think something that we are already starting to see and will see as a result of remote work is a flipping back. That all of that highest value, highest paid work for the highest educated folks doesn't have to happen in these three cities. I'm coming to you from Western Massachusetts, where I work in a community that I was already in before any of this started. But at least anecdotally, I can say there's certainly an influx of folks who have left New York and Boston for Western Massachusetts. Now, will some of that reverse? Probably as well, but certainly at the margin, the more that we have these sorts of high value industries disconnected from place, actually the more regional diffusion I think we will see. And that's probably the most important dimension on which we've seen inequality and can potentially reverse it. That will redound to sort of racial characteristics and others as well, but ultimately goes to the actual core source of the concern, which is the economic dimension. So I think that's.
Are you expecting an uptick in rural health and socioeconomics and maybe therefore a decrease in deaths of despair as a result of COVID like this?
I'm sorry, did you ask me?
The same interpretation as Oren does about this disconnection from place being good for rural areas and like Western Massachusetts.
Yeah, so I think that there are two important aspects of this to consider. On the one hand, this is potentially an opportunity for certain types of rural places. And that is the types of rural places where people actually enjoy being and want to live. High natural amenity, recreation rural areas that are already doing better than the other types of rural communities because they have the types of resources and services that people enjoy consuming. They're pretty to look at. There are things to do. It's a nice way of life in those places. And if those places can deliver on broadband access, which right now is incredibly limited, there's a lot of potential for continued growth in those types of rural areas. On the other hand, there are a lot of rural places in the US that have been on the decline for 4 or more decades now, where there just isn't a lot of hope of revival, even with the potential of remote work. I'm thinking of a lot of parts of Central Appalachia. I'm thinking of parts of the desert Southwest, where economic conditions have been declining, employment opportunities have been declining, and of course, life expectancy has been declining now for several decades. And so we are, I think, going to see a continued divergence of different types of rural places along all of these conditions that really matter for well-being. The other aspect of this that really matters is no matter how much you make remote work possible, there will always be industries where in-person work is required. And so I'm thinking about agriculture, certain types of manufacturing, certain types of service work. And so here you're going to have the need for employees in those industries to continue to show up in person and do that work every day. And we as a country need to show that we value that kind of work through livable wages and good benefits and decent time off. Otherwise, we'll continue to see increases in inequities between people who have the types of jobs where they can work remotely and people who have the types of jobs where they can't. And that one of the conditions through which people are able to work remote versus not is often educational attainment. And so we need to value the types of work that don't require a 4-year college degree.
How do you see that future, Oren? Do you think it's going to be as uneven across the country as Shannon does?
I certainly agree with Shannon's point that there are places in the country that are not going to suddenly attract a lot of remote workers. That being said, I think there are an awful lot of places that are just places where people live and grow up. And what is a draw to people more than the beauty of the natural habitat is where their family and community is. And so the prospect of more people being able to live where they would like to live if there were job opportunities, I think is a very positive shift. I certainly agree with Shannon's point that there are a lot of industries, obviously, that people need to continue working in person, and that we need to value that work. I think another sort of post-COVID development that is very positive and we're likely to see continue is just greater attention to worker power. I think there was a real recognition during the pandemic that it made a big difference whether workers had any power and voice in the workplace. And coming out of it, we're certainly seeing more interest in unionization, for instance. And we're certainly seeing workers of all types using more leverage where they have it. And so, when we think about different types of jobs, I think the important thing to realize is that there's nothing inherently equal or unequal about types of jobs. If a service job is a challenging one and it's difficult to fill and you have to offer more money, for instance, to offset the lack of flexibility, then in theory, you'll do that. And workers who might be taking those types of jobs might benefit with higher pay. That's how we should want to see it work out. And that's the path to, I think, the kind of evolution in the labor market that we want. In my mind, the big question on that front is just, are we going to have the guts to actually hold tight on the labor market? And
what does hold tight mean?
It means immigration policy. And I don't know if we were expecting to get there in this particular discussion or you want to, but it means telling a business lobby and employers who are screaming that they don't have enough workers and we need to loosen up our immigration policies, actually no, what you are experiencing is the higher cost you are going to have to pay for this type of work. And that's going to cause all sorts of shifts in the economy, but those are the kinds of shifts we should want to be seeing and that we're going to have to be willing to lean into, I think.
Bradley, would that be good for reducing the disparities, a sort of continuing restriction on immigration and tight labor market?
Well, I mean, a couple of points here. So if you tell me there's a tight labor market and that there's a demand in sort of a excess demand, shortage of workers, that's fantastic for workers who have found themselves with more barriers to employment, workers who found themselves to maybe struggle to connect with job opportunities. So absolutely throughout the pandemic, I think it was just flat out a net positive for workers, worker wages, so on and so forth. Firms might have been belly aching at times, and you can understand that, but the economics of it were pretty clear, right? Now, I think that a point I wanted to make before we move on too far is that, yeah, you know, this new world we're in can have aggregate benefits. You can imagine looking at overall economic growth, whether you're looking at measures like GDP or otherwise, and saying, look, the innovation has made us more productive. But at the same time, there's going to be adjustments that are going to occur. You can think about your neighborhood dry cleaner. You could think about the folks who are doing any number of in-person activities that are now in less demand. Maybe it's a local gym or something like that. I don't think that those businesses have fully recovered. And in many instances, they won't fully recover. So you can have multiple things being true all at once. In the aggregate, it's transformative. It's transformed many of our careers and the way we do work. And at the same time, you'll have some folks who are going to have to make an adjustment, which is an elegant way of saying they're going to have to transition to some other employment opportunities. So, you know, I think that clearly there's probably, you know, an argument to be made that, yeah, you know, if you boost labor supply, then that's a way around increasing worker wages potentially. I think there's probably ways you could structure immigration reforms so that you could reduce certain forms of wage theft and things like this. But there is sort of a more tight point that, look, this excess demand for workers is helpful for them. Absolutely.
Can I ask one last question of Carol before we turn it to Tom, which is, Carol, I'm curious if we have this greater dispersion of white collar workers out of cities and more, you might say, socioeconomically integrated people in rural communities, is that going to help in mitigating the deaths of despair, or are we still just going to have, you know, we're going to have socioeconomic segregation just on a different level, even with more well-off people moving to rural areas?
So that's a great question. I was actually going to interject something else as well.
Okay, so interject to something else.
Okay, well, no, I think the answer to your question directly is sort of Shannon's answer as well, that I can see that in some communities, rural communities that are already more desirable, there'll be a positive boost. There's been some really good work from our Metro Center at Brookings on comeback towns, sort of the kinds of places that turn themselves into the kind of places Shannon is talking about. They have certain amounts of infrastructure, like a community college and an airport within an hour, that make a huge difference if people want to live there or not. granted, if I agree with Oren, it's nice if people can be with their families, but there are these structural realities and structural inequities across rural places that are big. The other thing, and here's where hope really does play a positive role. I've been doing surveys of low-income adolescents in Missouri, in African-American school districts and in low-income white districts. And what I find, and it's somewhat disturbing, and it speaks to the point of despair, is that low-income Black kids are much more likely to want to pursue education beyond high school, and somebody in their family supports them. It couldn't be a grandfather, it can be anybody. It's sort of a community sensation. I found the same thing in Peru, where the communities are very, education is the way out. It's drummed into you. And so and it doesn't have to be college education. But as we're talking about labor markets changing and jobs being valued, high school educations alone don't really do it in tomorrow's labor markets. The low-income white kids only want to go to high school. Their parents don't support them going to college or getting more education. And that these are regularities in the surveys that are remarkable. And so I think about the next generation in despair, and you're already seeing a contrast, and the sort of gap theory that we were talking about, whether you're going up or down and whether the gap is narrowing, is being kind of generationally kind of transmitted. And so I think that's still going to be a factor in deaths of despair. And obviously, the more worse off the place is, the worse it is.
Interesting. Tom, you're interjecting here. Questions from the audience.
Yeah, I wanted to bring one question from the audience that sort of bridges some of the previous conversation about the safety net and the economic response to current conditions. Is there evidence, this is from William Arnone, is there evidence that the federal response to COVID has been a major factor in contributing to the high current levels of inflation? So maybe this is for Bradley, maybe Oren, but connecting that back to the conversation of the panel as well. I'm very unsure about whether or not current data would give us any insight about the connection to current inflation, but how do you connect the current economic circumstance back to concerns about inequity concerns that might have been born of COVID in the first place?
Bill is channeling Larry Summers up here.
That's interesting. Yeah, and Oren and others, I want to make sure I leave room for folks to weigh in here. So, my view is that there's a couple of interesting points. I mean, first off, if we do kind of a cross-country analysis, I think Oren made the point, along with others, that the U.S. looked pretty strong on the fiscal policy response, the dollars spent, whether it went to families or to small businesses or not so small businesses, right? And at the same time, we see high levels of inflation worldwide, right? So just if you look cross country, that's one data point. Now, I think that frankly, you do have to make sure you make the point to folks that the stimulus wasn't, again, just to families. It also went to businesses, and they spend money, right? So even as we frame what economic assistance is, you have to keep that in mind. I don't think policymakers went into this thinking you'd have no impact on the price level or inflation. That being said, there's energy costs, supply disruptions, actual wars going on. So how do you pull that all apart? So I think we would have expected some inflationary pressures. I just don't think you can fully attribute it to the economic assistance. I don't think it's a zero, but we've certainly pulled back on a lot of those direct payments. You don't have the expanded child tax credit that I'd like to have. I'm not alone in that. So, my view is that it's not a zero, but I don't think you can in any way fully ascribe it to those sorts of programs.
Oren?
Yeah, I think we're probably almost in total agreement there. I don't know that I haven't heard a lot of folks trying to ascribe it entirely to it, and I certainly don't think you can. I think Bradley kind of gave a good list of factors that are all contributing to it, and one of them, I think it's important to emphasize, high levels of social assistance per se aren't inflationary. The problem was the deficit spending. That is, it was the amount of money we printed and dumped into the economy. And particularly, I think what you saw happen to household balance sheets. I mean, I think it's terrific that people didn't all lose all of their savings during the pandemic. The extent to which your typical American household had unprecedented levels of excess savings at the end of the pandemic is I think where you start to worry that we turned the dial too far, at least with respect to what was likely to happen to price levels. I do want to just very quickly pick up one other thing Bradley mentioned that reminded me of something I wanted to mention, which is the supply chain point. And something else I think is likely to be quite lasting post-pandemic is the greater focus on reshoring and returning supply chains closer to home and in many cases to the US, which I think is going to have major labor market effects and also starts to get at some of the places that it's not about, white collar folks wanting to live somewhere remotely. It really is about additional investment in the industrial heartland in some cases.
Can I throw an additional point on the fiscal boost, which is the reason we look so good, I think one reason, not the only reason, in addition to the fact it was much needed here, but a lot of other countries, certainly European countries and Scandinavian countries that already have safety nets built into their system, into their tax system. They didn't experience the same kind of fiscal increase because they didn't need to. It was already there, right? So I'm not weighing in on inflation, but I do think, yes, we look good, we look great if you think about how much money we spent during the pandemic, but other countries were spending it already. They were they had a system in place to deal with these things. So anyway, that's my 2 cents.
Well, maybe I can ask Oren one thing. Do you think any upgraded UI in any CTC or some similar program are likely to become permanent?
I think on the UI side, there's definitely interest in upgrading the administrative systems. I think everyone recognized that it did not work well. And whether it's because you want to get money out faster or because you want to crack down on fraud, you can actually come together on wanting to see a system that knows who is where and what they've been earning. And I think also we're increasingly seeing UI system data being recognized as incredibly important for things like community college outcomes. So I think better data and systems in that respect is definitely something we could see progress on. On the CTC, I don't think there's any chance we'll see a permanent return of the unconditional one, just given what most people think. I think the striking thing, I made much hay of this, is, even the Biden administration only ever spoke about the policy as something for working families. There is no appetite for going to bat for the idea that a non-working, and much of it goes to the working poor, but there's little appetite for new cash programs for the non-working poor. I do think something like what Romney and along with Senators Daines and Burr proposed has real potential. I think as long as the Biden CTC was real, the Democrats weren't backing off it. But now that it's gone and not coming back, what Romney and Daines and Burr proposed is more generous than anything, Obama, Clinton, or Biden ever ran on. And so you would hope that there is real prospects of that moving forward.
One last 30-second question that goes back. This goes back to one of the questions that we got even in advance of the panel. There's been a lot of talk about the social safety net, generally speaking. So I'm wondering if anybody has comments on other concerns of other elements that comprise the safety net. Specifically, we got a question from Deshaun Carr at CBPP about whether any of you have any insight on whether or not the pandemic has affected other social programs like TANF, SNAP, any comments on the prospects of those programs moving forward. Anyone?
Bradley.
Well, I would just say briefly, I think many proponents of that temporary CTC boost really observed that many of the state TANF programs, the cash assistance programs, had really become sort of qualitatively hollowed out versions of what folks might have expected them to be. Even some people who were on the Republican side in crafting TANF reform, many states just retreated from cash assistance. So it depends on where you live, right? You can't generalize, but I think that maybe it will open up a conversation around, look, are there ways in which you can think about the delivery of effective cash assistance to families, if not in the CTC form, perhaps in other forms and ways?
Fair enough. And with that, we'll close out. I almost forgot to say, for anybody who's still with us and listening, this whole volume of research is open, ungated, and available to the public for at least another month. So if you want to go and look, you can just search the Annals of the American Academy of Political and Social Science and go back a couple issues. ann.sagepub.com takes you to our volume. Thank you very much, Zeke, Emanuel, for agreeing to moderate, and to the rest of our panelists for joining. It's just been a pleasure to help in bringing this together. And thanks, everybody. I think we'll close with that.
Thank you.
Thank you.
Thank you.
Have a great day.